Hello, everyone. Good morning, afternoon, or evening, wherever you are. Thank you for joining this month's Fireside. My name is Kirolis Riyad, and I lead the Waste Not, Want Not initiative at Concordia University here in Montreal, Canada. Today, I have the privilege to chat with Andrea Cartile and Dr. Lillian Lee. Before I introduce Andrea and Dr. Lee, I would like to highlight two goals of these firesides. The first goal is to better connect our different communities. So we have all put our full names and encourage you to add us on LinkedIn. The second goal of these fireside chats is to learn from one another. So Simarjid, who is now hiding in the background, will join us towards the end and moderate an audience Q&A. So please write your questions in the comments and by all means talk to one another. I also encourage you to think about this question as you listen to our chat. What lessons can the healthcare system learn from the pandemic to reduce its waste? I invite you to share your thoughts on that question with us and with one another in the chat. And finally, I would want to mention that sometimes there is a significant time lag because of internet connections, and I ask you that you're patient with that. With that, I'm honored to introduce Dr. Lillian Lee, General Surgeon and Chief of Surgery at Anna Laberge Hospital. She believes in making conscious, everyday decisions for an environmentally sustainable practice within the standard of care of medicine. I'm also excited to welcome Andrea Cartile. Andrea is a PhD candidate at Concordia University and is a member of the Chief Science Advisor Use Council. Andrea volunteered to collect personal protective equipment waste data in the summer of 2020 for a project that's led by Justine Amendolia and Jacqueline Saturno. Justine couldn't join us today, but I would like to play a video from another fireside I participated in with her that was hosted by Dr. Mona Niemer, Canada's Chief Science Advisor, in which Justine talks about that project. So I'm going to play that that video now. Just a second. Here we go.
So on the plastic consumption side, this is actually something that the pandemic has impacted a lot. I think a lot of us can see it. But Justine, I know that you've been working on a project specifically on this. So perhaps you can tell us a bit about it and about the data that you've collected so far.
For sure. No, and that was an excellent point you ended off with, Dr. Niemer, with regards to the need for data, because that's where we are with the pandemic. I mean, and plastics, since we started, I guess, the lockdowns in 2020, we've seen shifts happen throughout our plastic consumption in our daily lives, from using extra packaging at the supermarket to not bringing your bags, all the way to takeout containers from the restaurants. But one thing that I think we've all kind of clued in on is the fact that there's new types of items that have entered our daily consumption patterns, ranging from plastic gloves to masks to having kind of Costco-sized disinfectant wipes set at home, and making sure that you're stocked up for sanitation. So there's a lot of plastic that's entering again our consumption that was never really accounted for beforehand. And understanding how much we're using and where's it going, I think, is an integral part of understanding how we can improve. And one thing that happened in the beginning of the pandemic was I was actually stranded in Toronto. I never intended to end up back home near my family, simply because I was going to be doing field work in Alaska and it was going to be great. But upon returning home and seeing all these patterns evolve, my partner and I decided we're going to pick up our cell phones and, instead of texting, use citizen science technology to map out these patterns of where all this pandemic waste is leaking into. Canada's home to some beautiful different landscapes and environments, and we really wanted to understand how our local ecosystems were being impacted. So what we ended up doing was monitoring a series of different areas and asking the question, how does human activity alter pollution, and how does it impact the different types of PPE items that we're finding, which is personal protective gear, anything like masks and gloves. And it's actually been a full year since we started. So we've tracked about 6,000 items in a variety of different environments, and all using citizen science, so fairly accessible technology. And the whole goal is to really understand, where are the sources and why are people doing, why does PPE end up in the environment to begin with? One misconception that I want to point out is a lot of the times the narrative is, oh, people litter. But honestly, going to the literature, only 2% of the plastics we find in the environment are actually from littering. a lot of it's from waste mismanagement, for example, like garbage trucks picking up the cans and, some spillage occurring, or the garbage bins tipping over, for example. So within the scope of our research, what we found was really interesting was leakage from places we never expected, like hospital districts. In Toronto, we found they had the second highest density of PPE, which for a waste management system that's very tightly regulated normally. I mean, I think I can speak on behalf of everyone in this Zoom call that you never go to a hospital and see piles of masks or gloves in the hallway, but yet you're seeing them outside the entrances during COVID, which is a little mind-blowing. And one aspect I think with this research I want to emphasize is the fact that it's accessible. That to do this kind of science, you don't have to go to university and get your PhD in waste management. All the tools are there for folks to get involved. And also looking at what policymakers can do. I think there's a lot of opportunity for using this kind of work of having rapid assessments during very stressful times like pandemics, so that we can save ourselves a lot economically down the line when we do have to clean up our mess. Because with COVID, in fighting a public health crisis, we've somewhat put ourselves in a huge environmental disposition with the amount of waste we've generated.
Well, so Andrea, one of the things that Justine has referred to is a term called citizen science, and I'm wondering if you can explain what that means and what your role is as a volunteer in that project that Justine has led, and maybe you can reflect a little bit on your experience.
Yeah, certainly. So Justine and I are both on the Chief Science Advisors Youth Council, which is how we know one another. And at the beginning of the pandemic, there was a lot of uncertainty. And Justine had started this project collecting waste in Toronto. And she had asked people she knew kind of around the world, actually, if they could participate in collecting waste in the environment and tracking it as well. So she had put up a protocol and asked us to download an app, which was called the Marine Debris Tracker. And the idea was to go around the neighborhood, pick a couple of routes, and collect debris or collect things that were on the ground and track them. So you're both cleaning up your neighborhood and you're tracking the data, so how much of each types of PPE, so masks or gloves or wipes, we were finding the neighborhood. So I jumped at the opportunity because at that point of the pandemic, everything was pretty closed down as well. So I thought, oh, great, perfect, an excuse to get outside and to just put something that is totally in my field. So I'm specializing in aerospace as part of my PhD. And I have just, I purchased an understanding of waste and how we manage it. Interesting opportunity to engage in something that I knew nothing about. And that's what I think kind of citizen science is learning about things that are maybe in your field or within your field of interest, not necessarily in your specialty. You're just an everyday person and you want to participate and contribute to something that is important.
Yeah, no, I agree. I mean, everybody generates garbage and everybody has an environmental impact. And if we leave this discussion just to people who study environment for all their lives, it's not going to solve the problem. And that's why I'm very happy Dr. Lee is here as a doctor, even though it's not something very specific on waste. It's also there's a lot of waste and things that are being consumed within the healthcare system. And Justine has mentioned that PPE or personal protective equipment are things that are new to our daily consumption, but they're not new within hospitals and healthcare system. And so I'm wondering, Dr. Lee, if, as a person who uses PPE all the time, how do you feel that kind of waste is managed within hospitals?
So again, kind of playing into this, I'm not going to pretend that I'm at all an expert in medical waste management. So as you know, I'm a general surgeon and my practice is almost solely clinically oriented with a very small part that's a little bit of administrative work as the chief. But I can say, however, that I do have kind of a behind the scenes view of how much we use PPE in patient care, specifically in the operating room or the OR setting. So from what I've read, the OR typically accounts for about 1/3 of waste that's produced in most hospitals in Canada. And that not only includes PPE, obviously, but everything that goes into the packaging and equipment for each procedure, for each patient. been specifically tracking the PPE waste, it might have given us a clearer idea of not solely what was recommended in usage, but what the actual usage really was. So the beginning was a bit of a catch up, and I think that's pretty much what happened all across the world. I went to so many multidisciplinary meetings throughout the pandemic, and a common problem was actually how quickly the garbage cans were overflowing. Like you talked about not seeing garbage cans overflowing, but we were seeing that in the hospital almost on an hourly basis at one point. And it seems to be less of a problem now. So I can definitely say that it's being better managed. Yeah.
I'm sorry, my internet dropped.
Yeah,
so
I know. I wasn't sure if we're still on or not. Yeah.
No, my internet dropped. I'm sorry about that. But okay, so I'm sorry, I might have missed a part of the answer. But if I go back to your work, Andrea, I'm curious what is the thing that struck you the most as you were doing that work and as you're going around the streets and trying to take pictures and collect this kind of data?
Yeah, so what I found the most interesting was kind of engaging in environmental waste, in everyday environmental waste. So this is something, so I live downtown Montreal, and it's something that you just kind of become immune to, or you stop noticing, right? It fades into the background. You don't, unless it's really obvious, it's not something we engage in, or at least I don't, in a day-to-day basis. And we also have, so the city provides services to clean the streets as well. So our streets are relatively clean and not really noteworthy. And what I found most interesting was actually looking down as part of this exercise and counting and noticing and kind of observing the life cycle of a waste in the street. So one of the things that struck me the most was so you have this, it's usually spillage from garbage. So you have receipts and you have napkins and you have all sorts of things that don't have much weight to them that fly out of garbages and that scatter. And what is get into the grass, and then the grass gets cut. So then suddenly you started with these things that had, some size, and now the lawnmowers go through them and they cut the plastics down into much smaller pieces. So the life cycle of that and the degradation of that plastic that you can no longer collect, right? Because it's no longer in something that's like even visible format. And then that really gets into the environment at a smaller, more widespread scale, I would say. So that kind of observation and engaging with the environment in this way, I thought was really interesting and something I wouldn't have considered or taken the time to notice outside of this type of project.
Yeah, my team actually visited a composting facility near Quebec, and they had like the composting heap, and it was quite littered with plastic actually, because people, there's a lot of contamination that happens. But they say, okay, well, the big pieces we sieve out. So this is like a filter of some sort that sieves the plastic by size. But he said, well, plastic also degrades into microplastics, and these things are impossible to remove, and it ends up in the fertilizers that goes in the soil. Dr. Lee, I spend a lot of time in hospitals. Like I spend a day every 3 weeks or so. And it's always striking for me how much waste is generated just because of my own visit. Of course, I understand that it's very important to make sure that everything is sterile so that there's no infection. And I really don't want to get infected. So I really appreciate all the work that's done to prevent that from happening. I'm just wondering if you see any opportunities to reduce consumption or the things that are being used without compromising standard of care.
Yeah, medical waste reduction. So that's not an easy thing to study in the hospital setting. As a background, just so everybody understands, there's 4 major types of medical waste. So there's infectious, hazardous, radioactive, and general. So depending on the type of waste, it is managed differently for disposal in kind of like a standardized fashion, for example, with certain decontaminating processes or incineration or things like that. So I won't really go into all of that, but for safety and efficiency's sake, like many people would say that the amount of medical waste generated in hospitals is just unavoidable. So rules are made for a reason, and all supplies need to be used and disposed of properly, or else we risk spreading infection and killing people. So I think I read somewhere that for each day, one single patient hospitalized can generate almost 1 kilogram of waste, and that's just on average amongst the departments. And it's very likely different from industrialized countries compared to lower middle income countries as well. So personally, I see two main avenues to reduce waste on an individual level. So either literally by choosing to use less and by sorting waste properly, for example, by recycling. So first, in terms of using less, so I'll be speaking like from a surgical point of view, because that's what I know. Surgeons are creatures of habit. So we tend to do procedures in a very systematic way, and we regularly use the same type of equipment. So as far as the standard of care goes, that can be pretty vast. Like, for example, the standard of care for colorectal cancer could be to do a colon resection. So we would remove part of the large intestine. So that same procedure could generate 10 pounds of waste for one surgeon and maybe like 35 for another. I'm just like throwing out numbers. It's so variable because it really depends on the type of instrument that one surgeon would prefer, such as like a disposable versus a reusable energy device, or the type of anastomosis that would be hand sewn with just like a few sutures, or with like multiple heavy plastic unreusable staplers. So often we just do what we're used to, and most importantly, what we perceive as to have the best patient outcomes. We do what's fastest and what's the most comfortable for us, essentially. So I think the key going forward is to not only think about our own ergonomics, but the cost. So not only in terms of literal money cost, but the cost to the environment too. I was trained by dozens of surgeons during my residency, and there was really only one or two that ever even mentioned the environmental impact of the types of instruments that we choose to use. So I actually do always kind of have their little voice in my head when I'm thinking about what instrument I want to use. And I try to make conscious decisions in the types of instruments that I choose. And as far as sorting waste goes, we're probably not the best either in the operating room. So we're often under this pressure to turn over quickly between cases. And a lot of waste gets like thrown together in the hazardous material. Whether or not it's hazardous, it gets thrown in with the garbage, whether or not it's really even garbage. Few, if any, of the hospitals I've ever worked in has a recycling process for the general waste that's big. And so much of what we use up is general waste. I mean, like every single OR day, I have this like little twinge of like seeing all the disposable, sterile packaging that doesn't even touch the patient, but it just gets like thrown in with the hazardous stuff. Like it's crazy. Something, however, that a lot of people don't know is that like a lot of hospitals, mine included, actually sell a lot of that packaging as an attempt to reuse some of the clean waste. So like when I moved, I bought a lot of the boxes and the blue disposable sheets to like wrap my stuff. So I'm hoping like there's, going to be like a more publicized way of doing things like that.
Yeah, it's really interesting to see how, it's the same procedure, same standard, same country, just having two different surgeons, one would generate.
Absolutely. And there's so many things to think about in the long run as well. Like, yes, there's like that point in time, I want to use this equipment. So like, for example, like doing something open, so with a laparotomy versus laparoscopy. So laparoscopy is like the minimally invasive with all the little incisions. So that actually has a lot more waste because we have a lot more tubing, we have a lot more plastic tubing of different things that are connected. But the time in the hospital is significantly reduced as well. And that has an environmental impact as well. Because like I said, it can generate up to 1 kilogram per day of patients being in the hospital. So those are all, it makes it so difficult to really decide what's the best thing to use at that given time. So we're just creatures of habit. We just do what we normally do.
Yeah. And it's less time, it's less cost too, because all of that is associated with cost. And a lot of those medical equipment are also very, very expensive, or at least I don't know. I'm always under the impression, like when I see some of those.
It's very, very costly. And I have to, make requests for certain equipment. Yeah. It quickly adds up.
So, Andrea, I'm wondering, so you're a member of Canada's Chief Science Advisor, and I'm wondering if you can speak a little bit about your role and how you feel youths are informed about waste in general and how we dispose of it and how we can do a better job in raising awareness.
So it's a bit of a loaded question. I don't know if I can speak on behalf of all youths, and I'm at the very it's a little sketchy that I'm part of a youth council. I'm feeling a little bit imposter syndrome on that end, but
I feel
So the Chief Science Advisor's Office decided, it must have been 1.5 years ago, or actually far previous to that, to start a youth council, to get, it's an inaugural idea for this particular office, and just to get an idea of, you know, what the youth perspective in government and science and kind of bridge the gap between, you know, something that's not, youths are not often, I guess, involved or included in these types of processes. So it was, it's an initiative to try and bridge that gap. And I was really happy to be selected as one of the representatives on this council. So we're 20 people, 20 youths from across Canada in science and engineering, and different in industry and academia, kind of all sorts of different representation. And in terms of how youths perceive the waste process, so I think my general impression is that we're getting a little bit better in terms of just general education, or actually more awareness of understanding that waste is a thing, because I think we are very sheltered from the waste life cycle process in general. In North America, we just throw things in the garbage and they're taken away. So we don't really have an insight into that kind of process, or where that goes, or what the impacts are of that. And even, you know, with new technology coming out, like electric vehicles, all that stuff, we don't really have a good understanding of the full life cycle and the full impact. Like you were saying, Dr. Lee, of, you know, what is the net of less waste that we're contributing to the environment. And it's very complicated, because there are a lot of downstream effects that can happen with waste, and that we just don't see. So I'm optimistic. I think that we are getting progressively more aware of the effects of our waste, whether we are, you know, reducing our consumerism in general, or whether we are changing our habits. I'm not sure yet, but yeah, hopefully we're on the right track.
Thank you, Andrea. Lillian, one of the things that you mentioned when you send your bio is that you believe in legislative change, trying to reduce kind of waste. And I want to point out that little comment that coming from the audience from Elizabeth. She mentioned a couple of organizations, the Canadian Association of Physicians for the Environment, and they seem to have a Quebec chapter that is working on reducing waste in hospitals and medical clinic. So just from an advocacy point of view, what kind of legislative change do you feel would be appropriate?
Yeah, so I mean, it's obvious in the last few decades, we've really transitioned towards single-use disposable equipment. And, you know, there are likely countless factors as to why that is, but the bottom line is that it's easier and it's cheap in the short term. So obviously there's a lot of studies that have demonstrated that it is more costly in the long run. And we didn't even mention the environmental or the ethical cost of mass manufacturing of these products. And that's where government legislation comes in my mind. Like, essentially, there needs to be clear ways and resources to track the costs of medical waste management and the use of single-use disposable equipment. So we need the initial funding to be able to switch to reusables, or financial incentive to do so. So I've read that some hospitals in the States reward departments if they demonstrate landfill reduction or increase the amount of recycling. And without that kind of short-term incentive to invest in the long run, unfortunately, we're always going to be more focused on the more pressing short-term issues.
Yeah, no, that's this always. I mean, it's always sort of a focus on, like, you know, the quarterly earning, like in companies, but I guess it's not be the same in hospitals. But it's always looking at what happens at the end of the year as opposed to on the long term.
Yeah.
Kind of cost.
So if you want to get people to change, unfortunately, that the incentive really needs to be there.
Yeah, no, I agree. I would like to end with a question that I ask all the guests that joined the Fireside of what does being a global citizen mean to you? And maybe Andrea can start.
Sure. So I think I always have a little bit of trouble with the word citizen, because it implies citizenship, and I just don't know if that's necessarily true. I think any person can try and engage in a world beyond themselves and figure out, you know, how it is that we fit into the larger picture of things, and how our actions affect others and the environment. So I think it's just kind of a process of engaging in that kind of dialogue, reading, and trying to make conscious choices as much as possible in the day-to-day. and all the way into getting very active, right? Becoming an activist, environmental activist, and really trying to make permanent change in the right direction to fight things like climate change. So I think any level of engagement and any level of thought outside, into the bigger picture of things and the impact of everyday actions, I think is related to being a person who's engaging in science or any type of global engagement. So that's what it is to me. And also to engage outside of your field. So you don't have to be a specialist in anything. You don't have to have a PhD. You don't even have to have any type of knowledge. So just engaging or showing interest and initiative and an open mind to these conversations, I think that's all it is.
Yeah, I agree. And I mean, from my experience, like I'm not an expert at waste either. I'm an aerospace engineer, just like you, and my master's and my PhD are materials. So it has nothing to do with the environment, has nothing to do with waste. But that project with Waste Not started, and you just try and learn as you go, and learn with the community. Dr. Lee, what does being a global citizen mean to you?
Yeah, I mean, I love what you guys said already, honestly. Just learn where you can beyond what you know and just kind of open your eyes, like being a global citizen. I think it's just making the effort where you can, whether it's in your everyday practice or advocating within your community. Just kind of pay attention to the needs and what's actually being used, and then understand that your individual decisions really have an impact on the world in some way.
Well, on that note, I think we're out of time for the Q&A, so maybe we can skip that. But I want to thank you very much, both of you, for being brave enough and exercising this global citizenship of speaking on a subject that you don't necessarily have to practice every day within your professional lives. And I really appreciate you being here and all the insights and having sort of a behind the scene kind of view on what happens at hospitals and what happens on the streets and getting the data on PPE. So I really appreciate that, and I appreciate everybody who's watching now. One thing I would mention is that when we announced the event, I got a message from someone called Kim Gomri, who was a previous guest last time, and she mentioned that one of the things that's happening with the surgical mask and how they're produced is that there's now an industrial facility that's planned to be built on Technopark, which is essentially a big area of wetlands. It's meant for biodiversity, and there's a big area of it that's for monarchs, where monarchs live, and monarchs are in endangered species where 90% of their population has declined since 1990. So it's not only what happens at the end life of these kind of waste, but also what happens, how they're produced and where they're produced. I'm going to share a little link to the article that she sent me. I got a lot from reading it, and I hope maybe people can also benefit from reading it as well. With that, I want to say thank you again, and really appreciate all your time. Have a lovely rest of the day.
Nice. That was lovely, and nice to meet you again.
Likewise.
So much, Camilla. It was a lot of fun, and thank you, Dr. Lee. That was super.